Hello, and welcome to a short video on clinical monitoring and escalation pathway. Before we begin today, UniSQ acknowledges the First Nations of Southern Queensland and their ongoing connection to country, lands, and waterways. We pay deep respect to elders past and present. This video aims to introduce clinical monitoring and escalation pathway. This traffic light system was introduced to monitor student progress during clinical placement. The CMPE shown here is designed for year-long clinical courses. As you can see here, there are 5 check-in points. The first 2 are before the commencement of the clinical courses to ensure the students are eligible and are prepared to start the midwifery practice placement experience. Residential school attendance is a mandatory requirement prior to commencing clinical courses. If a student fails to attend the residential school, alternative attendance options can be provided, which may require interstate travel. If the student is unable to attend any of the residential school, student may have to withdraw from the associated clinical courses and re-enroll for the next offering. Students are required to complete some mandatory documents to the in-place and get those verified before commencing placement. This includes forms like evidence of vaccination, police clearance, and facility or state-specific requirements. Work integrated learning team and BMID academic team can support students during this process. If the student is unable to complete this on time, that could lead to delayed start of placement. Once the students start their midwifery practice experience, there are 3 check-in points at regular intervals. At each check-in point, students are required to submit the following documents. Completed documents, portfolio documents. This includes completed episodes of care, learning tools, learning packages, and continuity of care experience documents. Some of these documents can be incomplete. For example, students may have recruited COCE but not completed the experience. In this case, the student can submit the consent letter to show evidence of recruitment. Students may have attempted to do learning tools but may not have received the required score. They can still submit the document to show some efforts. Record of student progress or feedback. This is page 88 on the midwifery practice portfolio. There are 6 feedback per page, and we require 1 page, which is 6 feedback per each clinical course the student is enrolled. This means if the student is enrolled full-time, student should submit 2 pages, which is 12 feedback. Student should aim to receive at least 1 feedback each week to complete this. Next is the assessment of midwifery practice experience, which is formative assessment, A, B, or summative assessment. After assessing the submitted documents, students will be placed in either green, yellow, or red zone, and action will be taken accordingly. If the examiner identifies any deficits, this will be communicated to the facility as well. A learning support plan will be initiated in collaboration with the facility and clinical facilitators if the student is in red zone. The most important thing to remember here is this is not a punitive process. This is to assist the examiner to monitor clinical progress and to put support services in place to ensure successful completion of the clinical placement. The students will also be referred to UniSQ Student Services for emotional and well-being support. If the student is unable to complete the requirement at the end of the course, we could look at possible extension of the midwifery practice placement. If the student is unable to get an extension or submit the required documents. This could lead to a fail grade for the clinical course. For further information on student requiring support, please watch students requiring additional support video. Thank you for listening. Please contact BMID academic team for further support.